LaReesa, I'm going to hand it.
Yes. Great, great. Actually, I think that is a perfect segue of what I'll be talking about. So last but not least, right? So once again, I'm Dr. LaReesa Ferdinand, and I actually have a wonderful pleasure of helping women in all stages of menopause improve their hormone balance so they can lead powerful, proactive, performance-driven lives. And today I want to look at it from the lens of performance and to share with you not only from this perspective and how we move this needle within this community, because there have been some great innovations, ideas, and like I said before, I think that's been a good segue from the last speaker, because this is motivated based on understanding women and clients much better. And I want to also share with you an important business strategy that I've incorporated not only with my clients and patients, but how I'm able to share as a consultant in this sector. So I did a simple question. Sometimes when we're looking at the bigger picture, oftentimes we have to ask ourselves a simple question to the population we serve. And I asked them in 1 to 2 sentences, how would you describe performance, or how do you feel like you show up every day in your daily activities, and what does that mean to you? And this is important because oftentimes as we guide our communities from what a mentor told me, from pain island to pleasure island, there's a journey and some unspoken journeys that we are still trying to understand. And I serve a very diverse community of people as a Florida-based physician. And the response had to do with knowing what the most important things and doing them in a timely manner. And these are women who are seeking out an OBGYN or a hormone advice or assistance in perimenopausal times. They still want to feel energetic and with a positive attitude. The fact that, yes, I want good sleep, but the why behind it is because I have curveballs that come my way and I want to be prepared. Knowing that I can go through an entire day and have a sense of accomplishment. Authentically understanding that they're showing up and being present and fully accepted and carrying out their purpose and their passions. And I love this, just getting stuff done and the ability to get it done and what you set out during the day. Because what I found in following a lot of the data and the markers of women adopting many of the wearable devices and the wearable technology and the apps and the innovations is oftentimes they still don't know how that personalized journey really does adapt to them, and what their goals and perspectives are for this particular community of women, and how to reach the performance levels that matter to them. So what am I talking about when I refer to the perimenopause and beyond community? I think it's a good time to identify that. These are women 40 and up, and they're heading through the change, or smack in the middle of it, or beyond it, or they just want it to be over. And we've had several speakers to kind of outline what that timeline looks like as far as years and experiences. But also this community, they're envisioning and functioning independently. And I like to use that word a lot because that's relative to the end user's experience. And it's also relative to what women experience within their journey throughout their lifespan, and know that they can live the fullest of their golden years like the queen. But many of them are still heading businesses. Women are increasing as far as women-owned businesses and the revenue that they contribute into our economic ecosystems. Then there's simple rules of engagement I like to make sure to recognize that no matter what, these are women who are beyond mediocrity. They want to live more fulfilled and stronger lives. They're ready to up-level their thinking, but they realize that it may not be encountered in their traditional clinical settings or within their doctor's visits. and they're ready to look outside of the box. And especially from a US point of view, oftentimes this is a sick care paradigm that doesn't necessarily fit them because preventive measures are in place, but not really concurrent with or congruent with what they may see in their research, because this is the age of a lot of technology and information. We're not sure exactly how it may apply to them. And so it comes to a form of using strategy. Strategy is one of the things I like to use as well, of how to strategically to be informed, understand how that information applies to them, and implement those actions, excuse me, so they can be able to achieve the optimal health and not necessarily fit into the status quo. But of course, there comes challenges with it. It's a constant feeling sometimes of having that distorted clarity because of the information or because of incorporating some of those things, and understanding there needs to be a guide of, okay, I may look good, but it doesn't feel right inside, or I feel like I'm putting more effort into things and I'm getting less out of it. Or if there's a change in how I'm performing and how I'm doing well in one sector, whether it be finances, but this is a time where I may have difficulty in the health component. And as much as, the fads and the fixes of what's built within certain media avenues of Band-Aid fixes or the guessing game of what actually is appropriate for them, by the time they get in front of their provider or practitioner, which is that know, like, and trust factor, they're at the point of, okay, I know something's off and I can't put my finger on it, but there, might be a conversation of, hey, deal with it, you'll be fine, or the lack of education to deal with certain things. And the actuality, this is a time of reality of transformation for women. It's a bridge into the next breakthrough versus the next breakdown if they do not feel like their problems or the way that they're seeing their problems are actually thought of from a holistic standpoint of really connecting mind, body, spirit. And I always like to say hormones, because I do believe in optimization of them in order to help women live longer and stronger lives. But to also embrace that there's no one size fits all approach, which is regardless been a lot of part of the thread of what we talked about today, which really drives the passion of even doing the level of work that I do, because it is a more personalized experience. It needs to be individualized for a more diverse culture and background, so no woman feels excluded. And then to dominate and understand that normal is not optimal. Those are two different things, and not to minimize those type of concerns for women. So who am I? Just quickly, I am Dr. LaReesa Ferdinand. I'm a CEO founder of Estrogen Doctor Company, and I speak from a tone of being a board certified OBGYN and integrating those things within not only a medical practice, but beyond, as implementing not only epigenetics, which is something that is starting to get a lot more pull and understanding, because it does allow that personalized approach, because regardless of many of the threads that are similar for women, perimenopause and beyond, when we're dealing with performance and what is important for them and what matters, it needs to be done in an edge that is more personalized for them according to what is, we've talked about nutritional plans, we've talked about stress components, we've talked about women that may be having menstruation or not menstruation in this time period. Excuse me. And part of that is adding that input into new startups, one including Bossa Bars, which is the menopause energy bar. And this is just a brief thing. And I think the last speaker did a great job, because there are hallmarks within this age period that are so vital. Beyond menstruation and children transitioning and changes in relationships and with themselves, there's a change in mental health and their mood and the motivation of life, and trying to trigger and putting those things together. Let's see. And then 50s and beyond is that noticeable change in the decline of some of the strength and cognitive abilities, the anxiety about aging, or knowing that there's a risk of stroke or accidents, or cardiac events and the significant body changes that may take effect. And all of that has to do with just noticing mentally and physically how that impacts with living longer and stronger. So one of the things that I've incorporated is understanding that no matter it's a bi-directional event when it comes to partnering with women in this journey, and it doesn't necessarily stop at the office visit. The return of investment is on the out of office experience. So incorporating those tools that are more engaging within now the FemTech space, but now it's trying to draw that in with the actual journey of how that connects to their lifespan, health span, and well span, because that scientifically has connected of how the quality of life of women living longer, not just in quantity, but we want to make sure, remember the word independently, or how they would want to perform at these ages as well. And so incorporating metrics and data points and key performance areas, it's a lot that we're doing now, but many of the things we talk about in the medical community, it takes about 2 to 3 decades for the shift to actually happen. And so we're hoping that it doesn't have to take that long, where women are speaking about their data points or their Oura ring or their particular sleep patterns, like a morning stock or sharing a recipe. And that's when we know that we've moved the needle a lot in that way, because we're conversing using the same language and everybody understands. And most importantly, the last link is making sure the medical providers as well, because I can tell you this, and this is a truth, that there's a lot more that is innovating in this space as opposed to the education that is even in the spectrum. And I'll speak from a US standpoint with our medical students or our doctors coming out on top of the restrictions or the restraints that may be within their communities or what their hospital-based providers are able to provide. And most importantly, not being able to really understand those experiences to a certain degree from that performance lens perspective.
LaReesa,
yes,
we've run out of time.
Oh, okay,
we need
sorry.
to move on to the Q&A. So
okay, no
I'll give
problem.
you like 30 seconds to wrap up, and then hopefully you can answer some of the questions.
Okay, no problem. So I'll just end with saying that the programs and the things that I do or implement have a lot to do with providing the connecting points for clients or for patients. And that's not only following the KPIs or the key performance indicators, but understanding how that connects with their performance-driven outcomes, what they perceive or what they know to be important for them. And that's when we start connecting the dots of how you can have longevity of any of the tools that you're creating. So, and this is a way to connect with me and also online through my website, drlareesa.com. Okay, thanks. Sorry about that.
No problem. Thank you. Amazing stuff.